The purpose of this presentation is to give you the overview about the subjects, teaching learning methods, assessment of the second MBBS subjects according to the new competency-based medical education guidelines laid down by the National Medical Commission. Now the overview. The total duration of the second MBBS is 11 months of the teaching followed by roughly 1 month of the university examination, and dear friends, this time this duration is even shorter because of this corona pandemic. Now the subjects that will be taught during the second MBBS, these are the primary subjects, secondary subjects, now or additional subjects. Immediately when I am talking about this, the question come in your mind that why the subjects are divided into these two, and the answer lies in that primary subjects are those subjects whose exam are to be carried out at the end of the second MBBS. It means the 11th month of the teaching, but there are certain additional subjects. Dear friends, you have already started learning about the community medicine in the first MBBS, but its examination will be carried out in the third year phase 1. This is an additional subject, and the most important part is the clinical postings. From second year onwards, your clinical postings in different clinical branches will be started, and this is 3 hours daily from Monday to Friday and 15 hours per week. And we have observed that the students are generally neglecting this clinical posting, especially in the second MBBS, because they feel that these subjects or the examination of these subjects are not there in the second MBBS. But clinical postings will definitely help you to understand the topic better, either of the pathology or microbiology or in the pharmacology. They will help you to correlate with the theory aspect better, and they will strengthen your base for the final year. So it's my sincere request, don't neglect this clinical posting. Okay, now the primary subjects in the second MBBS is pharmacology, pathology and microbiology. And as I have told you, the additional subjects are the forensic medicine and community medicine. Their exam will be carried out in third year phase 1, but university examination. There are certain internal examinations that are definitely carried out in the second MBBS. Now the teaching learning methods for both theory and the practical. Theory, first and foremost, you all know the interactive lecture, and it really means it must be interactive in the nature, and we are always promoting the students to ask more and more questions and to convert the lecture, rather than into the monotonous lecture, convert them into the sort of a discussion kind of the lecture. Then small group discussion. There are certain we can say that the areas where the requirement of the discussion is more, that we will teach in this small group discussion. Then same way the tutorials, and very important method of the teaching, that is integrated teaching. In that we identify the areas, say for example the peptic ulcer. In that we will teach you the pathology of the peptic ulcer. Then we will teach you the microorganism responsible for the recurrent peptic ulcer and the pharmacological management for peptic ulcer. So you can learn the topic holistically, and it will better help you to visualize the topic from a broader perspective and try to correlate the things. And a new concept it has been introduced, which is really important, that is self-directed learning. There are certain known core areas in which we will give you the hint or the guideline or the roadmap, and you have to prepare the topic accordingly. And in the practical sessions, as well as there are certain sessions for the skill demonstration, practical skill demonstration, as well as the communication skill exercises. So these are the different teaching learning methods. Now the examination or the assessment, obviously there is a one final university assessment that is also known as a summative assessment, and important one is also the internal assessment. These internal assessment, there is obligatory three internal assessment, that is first terminal assessment, second terminal assessment, and preliminary examination or assessment. It is exactly similar in the pattern to that of the university assessment. Okay, so this three internal examination is must, and based on this three examination your internal assessment marks will be calculated. But additionally there are multiple formative assessment methods that we are also going to be conducted, and that marks are also to be included in the final internal assessment scores. Now, which are these formative assessment examinations? So, for example, in the pharmacology, there are different systems, and at the end of the each system, we are taking the multiple choice question tests. Then we will teach you certain communication skill as well as the practical skills. So periodically we will evaluate these skills in the skill assessment exams, then the presentation of the seminar and certain quizzes. Now the purpose of these different types of the formative assessment is to identify or to let you know that these are your strengths, these are your weakness, and you have to work more on these weaker areas so you can perform better in your terminal examination and you can achieve better score in your final internal assessment as well as in the university examination. Okay. Now the most important questions that always come in the student's mind, that is eligibility for the university examination. There are two eligibility criteria. One is the attendance and second is the marks in the internal assessment. Minimum 75% of the attendance in the theory as well as the practical is must for appear in the university examination, and as I told you, we are calculating your internal assessment final score based on your two terminal examination, one preliminary examination, and multiple formative assessment. So your aggregate score must be 50% for the appearance in the university examination. But if we calculate the individually, you must have at least 40% in the theory and 40% in the practical. Okay, so aggregate 50%, that is fine, but individually 40% in the each tier in the practical is must for appear in the university examination. Now in the university examination, the pattern in the theory, there are two papers and each papers carries weightage of the 100 marks, and for that you will be provided 3 hours, and there is a separate 100 marks practical examination. Now, in your mark sheet, even though the internal assessment, 50% of the internal assessment marks are must for the appearance in the examination, but in your final score, these internal marks are not going to be calculated, and you have to successfully pass in both theory and the practical in the university examination with more than 50% of the marks. So this is overview about the duration, the subjects, the clinical postings, the teaching learning methods, the assessment during the second MBBS, and in the next class we will discuss about overview of the pharmacology. Okay, so best of luck for your journey in the second MBBS. I hope that you will pass through the second MBBS very successfully, and for that, we will discuss further in the next sessions. Thank you very much.